Hi, thanks Katie for being here. So you have been advocating, and the Alliance has been advocating for 16 years. So much has happened. Just talk to me a little bit about how it's evolved and the changes you've seen in civil society.
Sure. First, thank you for the invitation. Great to be here with everyone. I think the strength, the size of civil society over the last 16 years has changed dramatically. I mean, if you think back 16 years ago when the NCD Alliance was being formed, very strong civil society groups across different diseases, different risk factors, but at that point there was very little collaboration across the community. At that point, obviously, the NCD Alliance was formed and we really kind of got behind this shared agenda of common risk factors, common health system solutions. And since then, things have evolved and rapidly kind of strengthened in many different countries and regions. Over the last 10 years, we've seen almost doubling of the number of national and regional NCD alliances around the world. So we now have 72 national and regional NCD alliances. I think another thing that's really changed in the civil society movement is a shift from the critical importance of professional societies, which still remains the same, but also adding to that the community voice. I think Diana said it so well earlier in terms of lived experience, the patient voice, as well as youth advocacy, really kind of coming to the table and demanding further action and making it so much more people-centred. And I think also over the last 16 years, the actual role and recognition of the role of civil society has changed. I said this last night at our event on community engagement. 16 years ago, we were talking about and kind of justifying the role of civil society for so long. This is what we're here for. This is why we're at the table. And now that's very much recognised in terms of our role on awareness raising, advocacy, service delivery in terms of improving access, as well as obviously the critical role of accountability. So everything has significantly changed in the last 16 years, I'd say.
Yeah, we just came off the technology conversation, obviously, and when you first started out, we barely had social media, right? All of the tools that we now have to sort of galvanize people behind this. As we, the point of most of these conversations and for the gatherings this week is to sort of prepare for the high-level meetings. How has your strategy shifted, or has it? In what way? And how have those high-level meetings informed this conversation? How are you strategizing differently around them? And what are your expectations as we head into the September meeting?
Sure. So, NCD Alliance was set up to call for that first high-level meeting in 2011, of course. So it's always been, and it continues to be, a key part of our advocacy strategy. I think others have already said it well today. The rationale for why high-level meetings are important are very clear. This is about heads of government, heads of state. This takes it from being a technical issue to being a political issue. It obviously is an opportunity for governments, as the ambassador said earlier, to kind of come together and build consensus around the commitments going forward for action. And obviously the most important thing about high-level meetings is how they translate down to the national and regional level to really ensure that you have leadership from governments. But the other way that we've always approached high-level meetings, and that continues to stay the same, is that, yes, the political declaration is absolutely key, and we've all got our eye on the political declaration, of course. That's the official kind of formal outcome of this process. But it's the whole ripple effect of high-level meetings that is why it's so important, because it essentially means, every government around the world for 12 to 18 months are focusing on NCDs and mental health. Every single government and every civil society organisation around the world has that chance to be engaging with governments and putting it on the agenda. So process as important as the outcome, I think my message is. And then in terms of the second question about how high-level meetings have really translated into kind of building momentum around NCDs. You can point to so many examples of, at the global level, how those high-level meetings have accelerated the NCD response. The first one resulted in the set of global targets that we're all focusing on still today, 2025 targets. It also resulted in the build-up towards the Sustainable Development Goals. If we hadn't had those high-level meetings before 2015 and the SDG review, the SDGs, it's questionable whether NCDs would have made it into the Sustainable Development Goals, as well as all of the kind of collaboration and coordination that's happened since, including across the whole UN system, because if you think back 15 years ago, it was WHO who was pushing the NCD agenda, very little engagement from the broader UN system. And today we've got, UNICEF, UNFPA, UN Women, the United Environment Programme. You've got so many different United Nations agencies and programmes who are really focusing on NCDs. So they can have an impact, but equally, as we've heard already today from many of the panellists, the landscape for this one is tough.
Yeah, it's challenging. But I think that's a really important point you just made, because it's easy to forget. It feels like that language has been around forever, but it hasn't. And it feeds through. I mean, I talk to companies all the time, and in their quarterly reports, something as simple as that, having a framework for the conversation and the fact that NCDs are in that is incredibly important. So thank you for bringing that up. So against this challenging backdrop, I think it's really important to talk about successes and wins and how they can be scaled and pulled forward, as well as the challenges. So let's start with the wins first. What do you feel are some of the biggest accomplishments? And can we take that and build on that? I think Caroline made a great point. We don't always have to start from scratch, right? We've got some progress. How do we bring that back into focus and maybe build from there?
Yeah, and I think, this is another point that we were discussing at our event last night. I think it's really important that we are celebrating the successes in NCDs. We often talk about the challenges, many, many challenges, let's not lie. But equally, I'm very optimistic that there have been a lot of successes and wins over the years. To give a few examples, we've clearly got strong evidence around what works in terms of NCDs. We have the best buys, both on prevention as well as treatment. So in terms of what governments can do, we have those cost-effective solutions at our fingertips, and we know what works in NCDs. We didn't have that 15 years ago, let's be honest. We've also got a whole array of new global action plans, targets, strategies around the specific diseases and risk factors, which are building so much momentum around cervical cancer, obesity, diabetes, hypertension, you name it. We've now got really strong strategies, targets, technical packages that all governments have at their fingertips to be implementing. Of course, we've heard already from other panellists around the transformation that's happening in access to care, taking care to people, to communities, to people's households. One of the good things that came out of COVID, I would say, but obviously a long way to go. And obviously, in NCDs, we need to obviously focus on the care and health system side of things. But we also always need to look upstream at the primary prevention side of the agenda as well. And I think over the last 15, 16 years, we've seen really impressive ways that governments are putting their neck on the line, fighting back against unhealthy commodity industries, to actually put in place policies that are making environments more healthy in terms of increasing taxes, front-of-pack labelling, marketing restrictions, all of that good stuff that we know works from a public health perspective.
So let's jump to the challenge, and let's end with a call to action. What would you like the focus to be? Because there are many, as we heard from the other panels. But what is your call to action as we head into that September meeting?
I think everyone in this room has heard our call to action a few times, but as one of my colleagues said earlier, you need to say it 21 times in order for people to really hear it. So I'll say it again. NCD Alliance set out last year, it was a long time ago, our priorities for this high-level meeting. And we have 5, and they very much resonate with a lot of the points that other panellists have already made. First and foremost, this high-level meeting has got to be about implementation, as the ambassador was saying earlier, and those first panellists were saying. It's been a policy success, but an implementation failure. So in terms of your point about how our strategy has evolved, those first high-level meetings were about getting commitments. This one has to be about actually moving the needle on implementation and focusing on what works in terms of NCDs. The second one, which resonates with the previous panel, is unsurprisingly around financing and investment. I mean, we're obviously facing a very difficult landscape in terms of financing, but we've absolutely got to keep pushing this agenda forward because there's been so little funding in NCDs over the years. And so, things like real focus on domestic resource mobilisation, as well as public-private partnerships, but also really trying to use this high-level meeting to focus the community around targets for financing, because unless we've got targets, we're kind of shooting in the dark around actually what's needed. The third one is around breaking down silos. So again, using this high-level meeting as an opportunity, not just to put a spotlight on the NCD response, but also to be linking it to that broader global health and development agenda universal health coverage, humanitarian settings, food systems, so many linkages across sustainable development. I've lost track of what number.
Well, that's okay, because we're almost out of time, and jobs, I'll throw that one in too. But we know that if you can address those fundamentals, you can often check many boxes, which I think is why it's important for this to be part of the larger SDG conversation. And I'm glad you highlighted the progress, because it's easy to forget that when we're talking about the challenges. But everyone needs to stay motivated, because a lot has happened. And as we heard from the ambassador in the beginning, I think there's a lot of dedication that it will continue. Katie, thank you so much, not just for tonight, but for all the work you've done. Thank you so much.
Please welcome David Reddy, the Director General of the International Federation of Pharmaceutical Manufacturers